It's 2:10 p.m. here in Seoul. I'm Yoon Jung-min at the Arirang News Center. We are breaking into our regular programming for a live briefing from the Korean health authorities on the coronavirus outbreak. The briefing is just about to start. Have a look.
Let us now begin our regular briefing on the COVID-19 situation for South Korea for March 6th, Saturday. As of today midnight, we have 404 new local infections and 14 new imported cases. With this, the total caseload now stands at 92,055. And a total of 62,636 tests were conducted yesterday, and among them at the makeshift testing centers in the metropolitan area, we carried out about 29,704 cases of the tests, and we identified 75 confirmed cases. And today we have 353 more people being discharged, while 7,510 people still remain in quarantine. And we have one more person with critical or severe conditions, with the total number standing at 136. And we also had additional fatalities, and we extend our deepest condolences to the deceased and the members of the bereaved families. First of all, here are updates on the domestic updates. And in Seoul, Noanggu District, in relation to a restaurant, we have 8 additional cases, raising the total to 18. And in Incheon Micheolgu District, in relation to a family and social gathering, we identified the first index case on the 3rd of March. We identified 9 additional patients, and we identified a total of 10 people to date. And in Gyeonggi-do Province, Dongjucheon City, in relation to a foreigners cluster, through a makeshift testing center, we have 18 additional people being confirmed, and they are all foreigners. And we have been also carrying out further tests as well as further tracing as well. And in Gyeonggi-do Province, Pocheon City, in relation to a social gathering, we identified the first index case on the 1st of March. We identified 9 additional patients, raising the total to 10. And in Gyeonggi-do Province, Gunpo City, we also identified additional cases relating to a social gathering. A total of 11 people have been confirmed, with 10 additional patients being confirmed. And in Gyeonggi-do Province, Suwon City, in relation to a taekwondo studio as well as the daycare center, we identified further cases, and we have 6 additional cases being confirmed, and a total of 32 have been confirmed to date. And moving on to Chungcheong Province. In Chungcheongbuk-do Province, Eumseong-gun County, in relation to a glass manufacturing company, we identified 16 additional patients, and a total of 17 have been confirmed to date. And moving on to Honam Province, in Jeonbuk Jeonju City, in relation to a fitness center, we have 3 additional patients being confirmed, and in total we have 64 patients being confirmed to date. And next, Gyeongbuk Province, in Daegu, in relation to a family gathering, we identified further cases, and 6 more cases have been confirmed, and a total of 7 have been confirmed to date. And in Gyeongbuk Pohang City, Bukgu District, in relation to a 3rd family gathering, we identified first index case on the 3rd of March and identified 5 more patients, raising the total to a total of 6 to date. And moving on to Gyeongsangnam-do Province, in Busan City, Seoggu District, in relation to the 2nd Port Workers Union, we identified 2 additional cases, raising the total to 11 to date. And Jeju Island. In Jeju Island, Jeju City, in relation to a pub, we have 5 additional patients being confirmed. In total, 6 have been confirmed to date. And in relation to a bowling club in Jeju Island, in Jeju City, we identified first index case in later February, and we also identified 7 additional patients, raising the total to 8. Lately, in Dongducheon City, in relation to the foreigners cluster, we have some response measures updated. Here are some details. And related to workplaces, we are seeing many foreigners being confirmed with the COVID-19. And we believe that in Dongducheon City, the foreigners cluster, we have been able to identify a massive people of 132 people, thanks to our massive testing carried out at makeshift testing centers. And we are also carrying out further tests on their families as well as their relatives as well. And we are also having all of these patients on quarantine, and we are also tracing and conducting our epidemiological investigation. And considering their environment of living, we are taking a closer look at the industrial complexes as well as foreigners cluster in the country, and we have been setting up the makeshift testing centers. We are also cooperating closely with the Justice Ministry and the Labor Ministry to look into further cases. And in Gyeonggi-do Province, the northern part of the Gyeonggi-do Province, centering around the industrial complexes that hire many foreigners, we are going to intensify our testing as well. And at the makeshift testing centers, any people who are not documented, these foreigners can also get tested and without submitting their visas. And please note that their information will not be disclosed to the immigration office, so they will not face any discriminations going forward. So we ask all of the migrant workers to get tested, and also we ask the managers that employ these migrant workers to encourage these workers to get tested as soon as possible. Lately, we are seeing a global increased trend in the new variants. And after the February 24th, all of the foreign entrants, including everyone who are also Korean nationals, we are mandatoring them to submit their PCR negative documents. And this has been made compulsory, and this measure has been briefed to you through these public briefings on a daily basis. However, due to if you are not aware of these measures, you are bound to face discriminations or disadvantages. So we ask you to comply with these measures, and we would like to update you once again. If you do not have a PCR negative documents, if you are a foreigner, you will not be allowed to enter into the country. And if you are a Korean, you will be also put on self-quarantine. And also the people they themselves will have to cover their own expenses, meaning that this can be a great burden. So before arriving into Korea, please also get your PCR tested at respective countries before departure. And on the 26th of February, we had the National Assembly passing the revision act on the infectious disease prevention, and we would like to provide you some update with this. And after the March 9th, we will be implementing this, and this will take effect. And as for the major areas is also included, and one of the area is the compensation area. And if a person or individual has the risks of spreading the COVID-19, the government can also have this person be subject to indemnification and compensation. And also, we will be expanding the authorities who could put in place the gathering ban and other administrative orders, and they have been expanded to include city mayors and so forth. And as for the inoculations, we also prevent anyone who have illegal inoculations, and this has been added to the revision. And also all of the vaccines that are under development, as well as vaccines, if these vaccines that are under development are purchased or are signed or as contract has been signed in relation to these developing inoculations, we will also face them with penalization. And as of today midnight, a total of 67,840 more people have been administered with their first dose of COVID-19 vaccines, raising the total to 296,380. And at nursing hospitals, we have about 63,000 people getting inoculated. And at care facilities, we have about 50,000. And also at foreign first responders, we have more people as well. And also the COVID-19 hospitals that treat the COVID-19 patients have also administered the drug to about 5,000 people. And post-inoculation adverse effects, we have a total of 2,849 cases of adverse effects. And please note that 2,849 cases of them are common symptoms like headaches and fever or nausea or as well. And we had a total of 3 convulsions, and we are seeing one additional fatality, and we are under investigation. And as for the large-scale cluster infection stemming from the foreigners cluster, we would like to provide you some awareness. And please note that COVID-19, especially under the situation of pandemic, can also subject anyone to be subject to the infections. We shall never discriminate anyone against such a virus, and this is also a universal value as well. Moreover, we ask the migrant workers the following. Please note that in order to prevent the virus from spreading further here in South Korea, and in order to protect yourselves against the virus, we ask you to also get tested if you have any symptoms. And please, if you are a manager, please ensure that your workers can work at a safe environment, and please have ventilation and disinfection on a regular basis. We ask you to comply with the quarantine measures strictly, and we also would like to establish a spirit of culture where we can encourage the confirmed cases to get well soon instead of giving them discriminations. And this can only enable us to have a healthy society where people can recover and return back to the society. And this can enable us to be free from COVID-19 sooner or later. And we have seen full-fledged inoculations. However, we still have considerable amount of time before we reach our herd immunity, and on a daily basis we see about 400 daily cases, with the number staying stagnant. And we believe that we have many risks of the COVID-19 infections, so this is why we ask you to comply with stricter quarantine measures even after inoculation. We ask you once again, as for other countries that have started their inoculation plan, they have also seen a rebound in the number of COVID-19 cases due to not complying to the face mask wearing rules as well as social distancing rules. So we believe that this needs to be also highlighted once again. The following 3 factors. First, regardless of where you are, other than when you are consuming food, please wear your masks on a regular basis. And second, please comply strictly with the social distancing measures that are subject under each regions. And also third, if you have a fever or other respiratory symptoms, please get tested as soon as possible. And this is the first weekend of March, and we believe that there are many travelers as we have warmer weather, and we believe that they will be going to travel destinations, and also the multi-use facilities will get crowded as well. For the sake of your safety, we ask all of the public members of the public and travelers to comply strictly with quarantine measures going forward. And in order to free us from the threats of COVID-19 as well as other infectious diseases, the government will also make sure to exert our full efforts to ensure a return to normal for our citizens. Thank you very much.
That wraps up our coverage of the briefing this afternoon. Thank you for staying with us. We will be back with our regular newscast at 6 p.m. Korea time. Goodbye.